We endeavor to make decisions for the benefit of those who need our help and assistance in the county due to disability or illness. Also, we ask that you place your healing hand on all those that may be suffering from the virus, that they may fully recover. We ask all of this in your name, David.
Mm-hmm. Well, we've got a full group here today, except for yeah, so we're ready to roll.
Beth said she was on vacation this week.
Okay.
Haven't heard from.
Oh, that's right. Oh,
I saw him out in the parking lot.
Oh.
no. Okay.
He was on his phone.
Oh, okay. Yeah. We'll move on to our mission and vision statement. Please take note. And we'll move into public comment. I don't know if there's anybody online, Patricia.
I have no one.
I think everybody looks pretty familiar out there in the audience. But if you would like to participate in public comment, you're more than welcome. Consent items. Approved by consent our agenda for today, December 20th, as well as the minutes from back November the 22nd. So we'll entertain
So moved. And I'll support.
you support. Is there any discussion on those minutes? Bonnie, you usually are pretty good.
I read them through. They look awesome.
Okay.
Wow.
No
Excellent.
COVID brain there, Patricia.
COVID brain other places.
Since there's no further discussion, all those in favor of approval of the minutes and the agenda indicate by saying aye. Aye. Those opposed, motion carries. Old business, nothing. New business, our financial report, attachment A.
I
Keith
won.
just came on,
Oh, we did.
and Keith is muted.
Keith, you're muted.
Give me 1 second. I'm pulling up the financial reports. Sorry.
We're moving along here, Keith.
You guys are early.
Well, we're Johnny on the spot
We're
today.
in Talmadge time. 6.5 minutes.
You guys got me on my toes
It's
today.
in 2:30. We're all done.
I said it was-
It's like you're done before the meeting even started. All right, financial reports. Looking at the mental health fund, we brought in $5.3 million. We spent $3.3 million. You can see Medicaid still down low. That is because the LRE has not given us our final payments yet. They've rolled out a October payment early, and a pre-settlement just for cash flow purposes because their neighbors were complaining. But we're also, expenses are just starting to roll in for contractual services. So we're still $3.5 million below what we need to be, which is good. If you look at SUD, that's also why there's no Medicaid revenue in the actual spots yet, because our preliminary payments are just for mental health. And so the settlement payments come when they pay SUD funds. The millage is below, or the millage is in the negative because there hasn't been, we start collecting that in January and February from property taxes. But we're also underspent for projected expenses too. So again, that takes a little while to get off the ground. Now, if you look at Medicaid budget to actual difference, $2.6 million under budgeted. That's again, because the LRE is not sent or the state hasn't given them the actual settlement funds yet. I know that was a really quick overview, but are there any questions about the financial statements?
Yeah, when is that money due and when do you expect it?
Well, they're way behind. Typically we get it by now and we should have had it already. So we're 3 months into the year and still don't have a final settlement for October. So I would hope any day now for October's final settlement. Usually it's within 3 weeks of the end of the month. So like we would see a final settlement in the middle to late November for October, but now we're in the middle to late December.
Keith, who's behind, the LRE or the state?
The LRE says that they haven't got the allocations from the state yet.
Okay, okay.
Yeah. So they're
So
blaming the state.
And now I'm going to ask some questions and I don't expect you to know, does the state know why they're behind?
That has not been shared with us why they're behind. No, I mean, the rates were announced. They announced the rates and they were where they said they were going to be, but they have not paid from those yet. So the last finance wrote, they still said that they don't have any detail.
Okay. Okay, thank you, Keith.
You're welcome.
Okay, well, we're gonna need a motion for approval.
Supported.
Is there any further discussion? Seeing none, all those in favor of approval of the financial report, attachment 8, indicate by saying aye.
Aye.
Those opposed, motion carries.
And there's no bucket report this month because of that same situation that Keith's talking about. So
Oh, okay.
nobody's
That's
quite
fine.
sure.
We do have,
budgets are.
there is some good news though that I wanted to share. That's the next page. I didn't see if there was an agenda item or not. But the PA2 report, do you want me to cover that real quick?
Yep, yep.
Okay, so finally, after 3 years of negotiation, the PA2 settled with everybody. The county is sending a check today. As you'll see this report, the LRE is finally has a segregated bank account. So what you see is a 930 with a bank balance, an actual cash balance from Mercantile. We see that bank balance represented above and all the county balances of cash represented below. And surprisingly, they started adding allocation to that for interest, which I never saw reports on before. So that transparency is finally there. So the county decided to release the funds. That check is going out this Wednesday for cost settlement that the county funds have been holding. So as long as the LRE continues to uphold their side of the bargain with this quarterly report that I'll share with you, we're going to release, the county is going to release all PA2 funds that they received to the LRE.
Okay.
This has been a long time coming.
Yeah, yeah, it
But
is.
it's good work.
Yeah, good work, yeah.
Keith did an amazing job of researching what was owed and really stuck with it. So I truly appreciate
Yeah.
that he did that.
Thanks, Keith.
Yeah.
Thank you, sir.
You're welcome.
Nicely done.
Thanks.
Okay. Our recipient rights annual report, which is attachment B. And
So
Brianna is
Mhm.
not here today.
Correct.
Normally she would do that whole report, correct?
yeah, this is due right about now. She is on vacation though and had to move her daughter back from out west to college and couldn't change her schedule. So we sent that out to you for your review ahead of time. I can try to answer some questions if you had it. And then the plan is that she will go over that at our, I think, next meeting or the meeting after
That's
that.
March, the next
Yeah,
meeting for
okay.
March.
Wasn't this canceled?
Yeah,
Didn't
the
they get any memo saying that this
Yeah,
was
the
canceled?
recipient
Okay.
rights was canceled.
Okay,
so-
thank you.
But this report has to go to the state by the end of the year.
Yeah.
Oh,
Okay, so we still have to
Yes.
approve this.
Yes,
I have a question,
you bet.
looking at it. Do our clients know how to file a recipient rights?
Yeah. They should, definitely. We review that with them. They're depending on where they live or their situation, but our staff, we attempt to make sure they know what to do. We have to go through annual rights training so that they can then help their consumers know. And we do get rights complaints from individuals that we serve.
Mhm.
Okay, well, I entertain a motion for approval of the recipient rights annual report as presented.
So moved.
Support. Further questions? All those in favor of approval of the recipient rights annual report indicate by saying aye. Aye. Those opposed? Motion carries. Okay, attachment C, which is our Board of Directors meeting schedule. What does everybody think? Looks like same starting time,
Yeah. Good.
2:30. Really kind of like how you rolled everything in together, so we didn't have.
Yeah.
the separate
Mhm. Yeah.
finance.
Yeah, that's worked well.
I think so. That way everybody hears it.
Yep.
And doesn't have to be repeated for others. Yeah. Everybody, we got all of our different reports too, don't we? Oh, yeah. Annual public hearing, organization meeting, yep. Well, if everybody's okay with it, we'll entertain a motion for approval of that board meeting schedule as you have it in front of you.
So moved.
In support. Any further discussion? All those in favor, approval of the schedule, indicate by saying aye.
Aye.
Those opposed, the motion carries. All right. Moving right along here, we've got D. Session D, if I can find it here in my little. Here it is. Okay. And this is the executive director's ability to sign amendment number 2 to fiscal year 2021 Medicaid managed specialty supports and services, which includes the 1115 demonstration waiver, 1915 Parents C, Parents I waiver program, Parents S, a Healthy Michigan program, Flint 1115 demonstration waiver, substance use disorder community grant program subcontract agreement.
In plain English, what is that?
So this is our contract with the LRE.
Okay,
That is the same contract with minor changes that the LRE has with the state. And so the LRE has been asked to sign an extension to the contract, and so therefore it's getting pushed down to the CMHs.
oh, okay.
And not so long ago, I came with an amendment through December 31st of this year for the contract that is supposed to start October 1st. And so now this extension is going all the way through September 30th
Oh,
of 2022.
oh.
So I'm not exactly sure what the holdup is, but there's a couple points of disagreement between the department and the contract negotiators on the CMH PIHP side. One of them is the standard cost allocation project that they're asking us to participate in, which is a huge change and multi-faceted change in the way they want us to report our spending costs. And it's been rather controversial. So I think that's probably one of the sticking points. There's also some self-determination language in the technical guidance that I know was controversial. So I'm not sure exactly where the holdups are, but they're asking us to continue basically with last year's contract into this year.
Okay.
Well, in terms of changing the way that's the LRE spending or finances.
Say that again, Bob, I'm sorry.
The state wants to change the way the reporting is done.
Yes, costing reports.
Does the state explain why they want it changed?
Yes, they want standardization, you know, up until now, every CMH has its own method of
So they're looking to
costing.
get it standardized across all
Yes.
of the CMHs.
Yep. Yep. Yeah, they've promised us that they're not going to set caps based off this standard cost allocation method, but you know, you wonder if that's what the plan is. But nonetheless, that it's been quite, the board association is involved and they've gotten some attorneys' opinions, and so that might be it.
Okay. Need a motion?
Hang on a minute, Matt. Oh, I read something different. the E part.
That's something different.
That's something, okay.
Yep.
Okay, thank you. I'm
Yep.
sorry.
No, that's.
Yeah, I'll make them.
Well,
This is
this
E.
is it.
This is the
This is
second
it.
part of it.
Okay.
It just
Okay.
talks about the
Okay.
details.
Okay, and, and what they did, okay, help me with this a little bit. They broke it down on how much money Ottawa County would receive, kind of.
Yeah.
Okay, so Medicaid would be 41 million.
Mhm.
Health and Mission would be 6 million.
Mhm.
Okay, the substance abuse, that's how much they plan for Ottawa County to use, right?
Yep,
Those two numbers.
yep.
And then the last one, that's what their idea is, what we are getting for the PA2
Correct.
funds.
Yep.
Okay, now has, and I should have known, that has gone down, hasn't it?
Keith, are you still on the phone?
Yeah, do that.
Shoot.
Oh,
I can shoot him a text.
no, I'm just wondering, I thought it was around 400,000 or close to 5, but maybe I'm wrong.
You know what? I think you might be right. we'll check with Keith and we'll,
Yeah,
if he
there's
doesn't
nothing
jump
we
back
can do
on.
about it, but it is what it is. But
Mhm.
I thought Detroit 2 years ago, something came up that some of that money is going, I want to say it's going to Little Caesars. The arena, yes,
arena, yeah.
some of that money is going for that. So,
We'll check it out and let
Okay.
you know, but I think you might be right on that too, actually,
Okay.
that I think it's gone down.
okay, thank you then.
We do have a pretty significant savings in our
Yeah,
PA2,
I see.
so
that.
we'll do okay, even if there is a reduction, but
Because we're gonna, I mean, yeah, we're gonna use up more money than what we're getting for that.
mhm.
Anyway, okay.
Then just another example of monies that should be coming to this county that are going to the east side of the state instead of for some special project.
Well, it was originally spotted, it was originally also set up to go to the arena,
Cobo Hall.
Cobo Hall, yes, that's years and years ago.
Forever,
Some of
yeah.
that money
Yeah.
went there too.
Yep.
And now, so.
Find something else.
We didn't get to vote on some of that.
Right.
Right.
So
Right.
Bob, Keith might be able to answer that question too. Keith, can you hear me?
Yes.
So we have a question about the contract amendment, and it lists out all the amounts of funding, and Al had a question about whether or not our PA2 funds for this year are lower than they have been in the past. Do you know?
Are you talking about the PA2 funds that the county receives and passes on, or which funds?
Yes.
Yeah,
So it,
I would have to compare
says-
to this year, but we average over $500,000 a year of received PA2 funds that transfer to the LRE. So I think it was $570-some thousand that they owed for 2021. We transferred a little over $1.3 million, and 570,000 of that, I'd look up exact numbers. I think 570 was for the 2021, and I believe that was up from prior years because of increased alcohol consumption during the pandemic.
me.
okay, so
Why is it 240?
yeah, what we're looking at, Keith, is our attachment D, which is the amendment to the contract from the LRE to us. And on the last page, Exhibit E, they have listed out the various amounts of funding that we should be getting. And so PA2 is only at $249,824.
I'm trying to find that report. Yeah, so we have never spent what the county has transferred. That's why after this transfer now, we're going to be almost $3 million in holdings at the PA2 level at the LRE. And so part of that is the budgeted amount is how much is budgeted to spend and not how much that they've received or have on hand. I don't know if that's answering your question.
Keith, in Exhibit E, and it's one of the last sheets of the whole packet that was sent out. And on the bottom, it says Public Act number 2, PA2 liquor tax funds. And we
Yep.
have a number of 249,000.
Yep, I see that.
That makes sense that that's what the money that Ottawa County would be getting for the liquor tax. Now, I'm thinking that's low, or is it paid twice a year?
So the liquor tax comes into the county 3 times a year, and that should be the amount. So these are this is what they're saying they're going to pay to CMH, or pay out of our fund, not how much they're going to receive. So this,
Okay.
so this amount of money is not what the county is receiving or giving the LRE. So their LRE is going to get over $500,000 to PA2 funds.
Okay, okay, thank you.
Yep, you're welcome.
Good catch, Al.
I know,
Yeah.
just,
I sit at your feet.
yeah, I know.
Okay. We'll need that motion to approve this.
So moved.
Further discussion? All those in favor of the one-time specials or the attachment D and Exhibit E, authorizing Lynn to sign the amendment, indicate by saying aye.
Aye.
Those opposed, that motion carries. Your executive director's report, and then you're going to explain one-time special assessment.
Sure.
Bring us up to speed on that,
Okay.
if you would, please.
So we can do that first. I talked about this last meeting as well. As you know, we have been working with the Board Association to do some information, education, and advocacy around the proposals that are currently out there. Shirkey's bills are in the Senate, and Mary Whiteford's bills are in the House right now, or I think Mary Whiteford's are still in subcommittee. But nonetheless, the Board Association's been doing, I think, a very good job of trying to get information out there about what our concerns are, trying to make sense of what the bills might do to our system. And about a month and a half ago, Bob Sheehan, the director, approached the CMHs and asked if we would voluntarily participate in a special assessment, which dollars will go to further the efforts. Our dues typically help with this, but really the amount of work they've been doing and the reach that they want to accomplish really needs additional funds to do that. So what I recommended last month, and then we're coming to formally this month, is to basically make another payment, which is equivalent to our dues, which is $14,577, to go towards that special assessment, which is working on those advocacy efforts. And there's been some discussion about this throughout the state about whether we can do that. We can't lobby. Obviously, you can't use Medicaid monies to lobby. Bob Sheehan has gotten an attorney's opinion on this, that in their opinion, this is an appropriate use of Medicaid dollars. It's really no different. We pay for our dues, which includes advocacy, out of those funds as it is right now. So I'm recommending that we do this. There are probably at this point 20 other CMHs that have done similar things. Not the same amount, obviously.
Where are our LRE partners at in this?
I believe at least 2. I think West Michigan has already moved forward,
Okay.
and I think Muskegon has as well.
Okay.
I think a lot of people are doing what we're doing. It has to go through the board process.
Right,
So,
but it would seem odd if only half of the LRE group decided to go ahead with it, and then the other ones reap the benefits without paying, you know?
yeah, it's you know, the dues are based on your revenues.
Mhm.
So it's always a different amount. And Bob kind of left it open. You could give any amount you wanted. So some people might be giving, really depends on how much funding they have to.
Yeah,
to
seems like the
spend.
LRE would give some direction though on this.
Yeah, they talked about it, but they did not talk about necessarily a united front on it.
Okay.
Any conversation with Network 180 where their thinking might be?
I have not personally. I can tell you who so far has given dollars, if I can get on. I can't get on the system. I'm not sure where Network 180 is. I don't know that anybody is opposed to it. I know that everyone appreciates the efforts. It's making sure A, they have the funds, and B, making sure that they're doing what they need to do to feel like this is something they can do.
And it's also, some of them have to have their mental health board approve of it, and then they might have to go to the county commissioners too?
The authorities don't typically go to their counties. No.
Okay.
Yes.
So our state legislators, are they just not getting the word? Or, I mean, I guess I don't understand why we need to be spending money to get to legislators who should be hearing us regardless, right? I mean, what is the issue, that they just don't hear what we're saying?
Well,
I mean, I know
no.
Al's reached out, I've reached out.
Yeah, this is
Matt,
going beyond legislators. This is really going, their efforts right now are really geared more towards the public and making sure that the public knows to communicate to their legislators. You know, this is going to impact everybody if Shirky's bills pass. So our legislators certainly know what the issue is, and I think most people are reaching out and talking and getting, you know, different receptions, which is what I got. Not that all of our legislators locally they were very willing to talk to me. I met with each of them, either Zoom or in person. It depends on how connected they are to mental health in what they do, what committees they sit on. They all understood it was important. They all understood my concerns. I didn't get one of them to say, if it comes down to a vote, I'll vote no, but they were helpful. I mean, they're concerned. They don't want bad things to happen.
We talked about it at length at our quarterly legislative committee on Friday. Brad Slaw was there, Senator Victory was there. The other two weren't, Lily and Meerman, but our lobbyist was also there, and he's been, Bob has been really pushing hard to oppose this, especially the Shirky bill. I think to answer Bob's question, I got the feeling at the LRE board meeting on Thursday that, at least by the chair of Network 180, that they're probably going to opt out and aren't going to voluntarily donate any more money. That's what he said at that meeting. You asked that.
Yeah.
Yeah.
I was just curious, where they.
I think that they have.
I'm even more curious about the discussion with Victory and Slaw.
My individual reach out to Senator Victory and he had mentioned that Lynn had spent quite a bit of time trying to explain it and things, but he's, if I was a betting man, I think that he would go along with the Shirky bill.
Yeah.
Unfortunately, I really do. But,
Well, I mean, I sent him a lengthy correspondence months ago, in detail about what the issues were. Same thing with Brad Slaw and Lily. Lily's a waste of time as far as I'm concerned.
There's a pretty cool little video I don't know if Patricia can
Yeah,
get
we're
that.
gonna show it at the
Oh,
end
you
of the
are?
meeting.
Oh,
Yeah.
okay.
Mhm.
It's like maybe 3.5
Yeah.
minutes that one of the partners put together. It's pretty nice. I mean, it brings it right down to an understandable.
The association is, using these dollars to get the word out to agencies, to families, to other advocates. That becomes critical because at the end of the day, we're the people that need to bombard these legislators.
Yes.
That this is an issue.
Right.
And they need, disappointed to hear that about Victor, but correspond again, but I don't know.
Well, he was listening
But others
on
need to do
Friday.
it, but others need to do it. That's so they fully understand.
Lynn made a good comment. Each of the legislators, they have their 2 or 3 committees that they concentrate all their time on. And sometimes when you ask the question, well, where are you at with, housing, or where are you at with short-term rentals and things, if they're not dug into that particular committee, sometimes they're a little bit at a loss as to knowing all in the weeds about other things in there.
And the first question Vickery ought to ask himself is, why did Shirkey run it through the committee that he ran it through?
Mm-hmm.
We know the answer to that question, because Shirkey controls that committee.
He is in
It
charge of
should
that.
run through the proper committee.
So, I mean, they're off until the 12th through the 13th of January, but that will
Start it all over.
it will start back up again. Shirkey is, because that will be his last year.
Yep.
And he wants
So
something.
this was going to be his last year.
Well, he's got one more year.
So the money would basically go to increase public awareness and through agencies or whatever.
Yep.
It's really important.
I think it makes sense. I really do. I mean, that's the advocacy group, your board association. I think only because I think Network 180 is financially pretty tight right now. And they're trying to, and what was really nice to hear was that the voting for the LRE is going to be changed a little bit, and you probably can, maybe you can mention that in your report. So it doesn't matter whether you're Network 180 and you receive X amount of dollars, or you're Allegan and you receive X amount of dollars. The amount of authority or power through voting, you'll get one vote, or each one will get, is it 3?
Yep.
3 for a total of
representatives.
15.
Yep.
Is that it?
Yep.
Because there's 5 partners in this, and each will get 3 votes. So there won't be top heavy where one partner has 5 votes or 6 votes and the other has 1 vote.
Given the size of Network 180 and the number of consumers that they serve, I would hope they would at least take their own initiative and get word out to their people, their consumers,
Yes,
what
definitely.
this is about, the problems it could create for them down the road.
That's a good
That's
question.
their
So,
issue.
sorry.
No.
So this will go into a statewide effort, or this will stay at the county level?
No, it goes to a statewide effort. Mhm.
So it wouldn't be possible to, reach out to like Senator Victor, he seems to be on the fence, as opposed to the senator who maybe really bought in or not at all on board.
Well,
how is that gonna work?
Yeah, it's not, this isn't necessarily targeted to legislators. It really is to get information and more public awareness of this particular, especially Shirkey's bills.
Right.
Trying to influence our legislators by all means. That, I use a lot of the information that they generate out of the board association to send to our legislators and to use as talking points. So I don't know, did I answer
Yeah.
your question? Yeah, okay.
It also goes for all the vendors that you use,
Mhm.
right? And put a little heat on them. And they also serve a whole bunch of our people.
Sure.
And then
Yep.
they find out about it. So we need a little bit more pressure on Victory's livelihood and say you're gonna go down in history as the one that ruined mental health.
You know,
That
Senator,
would be a question I would ask, and I will do that.
Yeah.
Because I do need to send in follow-up correspondence. I said, how, when this falls apart, if it goes through and our system starts to fail, the people we're intending to serve, are you gonna stand accountable
Mhm.
for your vote?
Senator Victory,
And that's up
honestly,
to us.
out of the 4 legislators that I spoke to, he was the most knowledgeable about this. A lot of it has to do with his aide. Stephen Gilbert is on the LRE board, and he knows a lot about it, obviously, because he's immersed in the regional politics and the LRE. It really, you know, for Roger Victory, I think it's going against basically the Senate Majority Leader and saying, yeah, no, I'm not going to do that. And at the moment, Roger Victory wasn't ready to say, yeah, I'm going to do that. I'm not sure. I didn't get a feeling whatsoever that he was 100% in support of Shirkey's bills. At this point, I didn't get a feel from him that he was willing to tell me that he was going to go against Shirkey. One thing he did say, and it's probably an angle we can use when we talk to him, is I don't know which committee Roger is in, but it's got something to do with law enforcement.
The Justice Committee.
Yeah, Justice Committee.
Yep. He chairs the Justice Committee.
There you go. So the Sheriff's Association has already come out against Shirkey's bills and in favor of the mental health system. And that might be an angle to use because Steve Kemker has already come out in a written statement and said, this is not a good idea. We support our CMH system. So I think Roger's looking for a way that he can, you know, with the influence he has in the committee he supports, how he can make his voice heard that makes sense, other than to just come out and go, hey, it's Shirkey, I'm going to go against your bill. Because it's all politics.
That you said it was a Sheriff's Association,
Yep.
statewide association.
Yep. Yep.
Okay, well, I would hope that would get some people's attention,
You'd hope so.
especially when you've got law enforcement coming out.
Mhm.
That has, you know, often is confronted with dealing with folks, you know, particularly with mental illness.
Absolutely.
Recognizing this is.
Another video I'm going to show you at the end of the meeting is our partnership with the Sheriff's Department and Holland Police Department with our CIT, which is Crisis Intervention Team. So that is up his alley. And maybe that's the way we keep talking to him is, I don't think Priority Health is going to sit down with your sheriff and talk about how we can form a CIT team. Maybe.
Well, that's
not.
if you get an insurer that's actually in the state.
Yeah.
You could get one from
Maryland.
Maryland. Not really connected.
Yeah.
So do we want to
I
address this motion?
would make the motion that we approve the request for the special.
Supported.
Any further discussion?
So how do we kind of go back to the association, make sure that we're kind of, it's public outreach? I mean, if it's just gonna talk to the legislators, I mean, we already talked to them, but this is about making sure there's grassroots support for, you know, opposition, I guess, in this case, to these bills. Is there any way that they're gonna report back to us? This is what we did.
Oh, absolutely.
Okay.
Yep. If you go on the Board Association website,
Sure.
under the advocacy section, there's quite a bit of information, but I don't have any problem letting Bob know if we approve this, that those dollars, that it is our desire that those dollars be used to educate the public so that we can influence our
Yeah,
legislators.
otherwise we're just spending money
Yeah,
to talk to the
that's right.
legislators and
Yeah.
we're already paying their salary.
Yeah, that's right.
You know.
Yeah.
it's like, why should
No,
we
this is a much broader
Right.
approach. It really is getting, honestly, everybody needs to know this is what might
Right.
happen.
So it's more of
and-
an education campaign.
Yep.
Okay.
Yep.
And the association is, I mean, they've been doing that already. I mean, sometime ago they reached out to me.
They're not listening.
Right,
Did a little video for them.
right. You're on our webpage.
So I mean, it is something that they've been doing, and obviously they've been doing it at some cost.
Then do we have any kind of, I wouldn't say response, but alternative financing that I know you've talked about in the past. So we're not just saying no to we're not saying no to sure, because this is some alternative ideas we have. Is there something we can?
But that was done. That was done back when the governor came out with his first boilerplate scheme. And the state legislature assigned a committee to look at this, and they came up with a whole set of recommendations.
Sure.
Shirky's ignored it.
Okay.
He's just thrown it out. He's back to doing what the governor wanted to do. Right?
Yeah, you were referring to 298, which 3 years ago, the same question was posed. Let's give all the money to the health plans, and an entire year's worth of talking and trying to sort it out, and advocacy and recommendations led at the time by Callie. Shirky just ignored all of it. And
that committee
put the proposal
included
back out.
those who are in support of the CMH system and those who would like to get their hands on the $2 or $3 trillion, whatever it is in our system. But they came out with a whole set of recommendations. At least, it provided a blueprint to start to work from if you're looking at trying to make effective quality changes to the system. And thrown it out.
But we have met with him. We met with him as a region. Actually, it wasn't a region. It was everybody involved in our lobbyist firm. So it was us, Muskegon, and Washtenaw. Met with Shirky probably 6 months ago and voiced our concerns. And he didn't change his proposal based on anything we said. There have been multiple groups meeting with Mary Whiteford on her proposal as well, trying to say, there is some good in here and you've got some good ideas, but can you change some of this language so that there's more protection for the consumers? There's a guarantee of public voice and governance. There's some protection for the CMH system, which is the safety net. All those things that really are the biggest concerns. Mary's been much more receptive, but still has not changed her proposal significantly. Shirky, every time you meet with him and say, what about this? He'll tweak his proposal a little bit so that there's, like for instance, when we said to Senator Shirky, there's no guarantee, there's no protection for the CMH system. He changed his proposal that said, for the first 3 years, these health plans have to contract with the CMHs. Okay, well, that's a 3-year guarantee. And then it goes on to say, after that, there's no guarantee whatsoever. So he fixes it a little bit, but it's still not good. So we'll continue to talk with them and hopefully get them to a point,
This is more about not say going around them, but just kind of building up some grassroots support against privatization.
So his neighbor knows about it and he doesn't want to look at it anymore.
We're not done talking with them. We're not done negotiating. But at this point, Shirky hasn't listened to really anything.
Al Jansen, he's not supportive of it either.
Well, so the department has been pretty silent on the proposals. And they have said they're doing that strategically because of exactly what I just said happened when we met with Shirky. When you say, all right, this is why we don't like it, he tweaks it a little bit so that, okay, now we can't have that argument. But he doesn't necessarily change the whole. The bottom line is giving $2.3 billion to a private for-profit company or two or three isn't a good thing in my opinion. And I don't know how you can slice it or dice it unless that goes away. The private for-profit part of it goes away, which no one's been willing to take that out of their proposal. I don't know that anybody's going to say yes in the CMH system.
Most can cost more. Administratively, it's gonna.
Well, it's gonna, you know, it's gonna save money, but you know where the savings is gonna come from. It's gonna come from the services provided to our consumers. And that's how they're gonna present their savings.
Yep.
I mean, they're not gonna say we're not serving people, but they're like, look at the money we saved. But you're right. I mean, you know, some time ago when the 289 thing came out, one of these companies, healthcare entities, was asked about, well, how are you going to treat or deal with folks with intellectual disabilities, developmental disabilities? And that CEO's response was, well, we'll contract that out. Well, you're going to contract it out to who? Another for-profit entity? How's that saving money? You just added another
layer, another administrative layer.
I mean, this isn't rocket science. I mean, if you ever run a business, for God's sakes, it's not, you know, it's not that difficult. And it just befuddles me why Shirky is pushing this thing so hard.
Yeah, he probably has a job waiting for him.
Bingo. That's where I'd put my money.
Well, we've got a motion on the floor and we've got a support for the motion. Unless we have any new information we want to share through discussion, I guess we'll call the question. Do we want to do a roll call or do we want to just do our regular? Patricia.
You can determine that.
We'll just do a regular.
Yeah.
All those in support of the one-time assessment payout to Community Mental Health Association of Michigan in the amount of $14,577 indicate by saying aye. Aye. Those opposed? That motion carries. All right. You can finish your,
your okay.
report.
So more information from the state. One of the big things we're becoming involved with, Region 3, which is the Lakeshore Regional Entity, is slated to go first, go live in the new MyCal project. I think I talked about this a little last time. MyCal stands for Michigan Crisis and Assessment Line. So they will be standing up 24 hours, 7 days a week, crisis triage, support, information, and referrals, including a warm line, and they'll connect back to our crisis services. So it's going to be statewide, and eventually it'll be available across the state, obviously with the different regions, but I'm not sure why, but we got picked as one of the regions that's going first.
Is that financed?
I think there was an appropriation, because part of this has to do with some legislature that was passed a couple of years ago to stand up. A lot of this is COVID funding.
You're still going to have your on-call people.
Yes.
Right?
Yes.
And now we got a new on-call system. It's not going to cost us any more.
No.
It just seems like.
It's actually, you know, depending on where you live in Michigan, there might be different responses or might be different things. We all have to have by contract a crisis stabilization unit of some sort. This might actually save us some money. Eventually, we could use this system instead of our on-call.
Okay.
Not our on-call crisis workers who go to the hospital and do assessments, but our answering service. So we currently contract with Protocol to do after hours. So it kind of consolidates it, and there's some good things. It's going to be better communication back and forth. That warm line is actually staffed by peers, so they're already getting lots and lots of calls. A lot of this was in response to COVID, but they're planning on continuing with this past COVID even. This includes that 988 number. I think everybody's aware that that is the national crisis line that anyone can call and get connected to the suicide prevention line. So it's all good stuff. Time will tell how we coordinate that and if there's any relief for us as far as having to pay for some services, that type of thing. I think I mentioned that Al Jansen, Al's the senior deputy for Behavioral Health Developmental Disabilities Administration, has been on leave for several months. He actually had a heart attack or something like that. And we don't know when he's coming back, which is too bad because Al is a good friend of ours. He was at the, he served as interim director for a second for the LRE. He's from this area, obviously, so he is missed greatly right now. Jeff Leafrich has been named interim. And again, I don't know yet whether Al's coming back or not, or in what capacity he's coming back. You guys are all aware of the tragic situation in Oxford at that high school, the shooting. The board association put together a really nice kind of compilation of things that can help schools that are available to anybody who would need them. The efforts, obviously, in that area, Oakland County, I know their CMH there became pretty quickly involved in some debriefing. We actually got a couple calls from local schools that asked if we did risk assessments on students, and that isn't something we typically do. Now, our crisis team, if someone is a danger to themselves or a danger to others, we will do a risk assessment, but we ask them to meet us at the ED to do that, the emergency room. I don't really feel comfortable going and meeting a student that isn't a risk to themselves or others, going in there and trying to do some assessment that said, yeah, I think this is okay, won't do anything bad. So we told the schools we would help in any way we could, but that we currently don't do that kind of risk assessment. So we'll stay involved. We're very involved in our school system, and of course, you know, we want to help in any way we can. Something else you might have heard about was the Surgeon General advisory on youth mental health. They issued a warning, an advisory and kind of a warning that said, you know, we need to pay attention to what's going on. Numbers have pretty much skyrocketed, which isn't news to you because I've been telling you about how busy we have been. But students in youth reporting increases in depression, anxiety are way off the charts, and you know, it doesn't. You don't have to think long and hard about why that is. Things are incredibly stressful right now. So what we're planning on doing with that 53-page report is review it carefully, and there were some really good ideas in there, recommendations for lots of different places, schools, agencies, businesses, you name it, parents. And where we can, we'll incorporate that into our strategy of what we're currently doing with youth in our community. We talked a lot about the House and Senate bills, so I won't go any more into that unless people have more questions. From the Lakeshore Regional entity, I've been trying to keep you up to date. They are still in negotiations with the department and the Assistant Attorney General to try to settle the contract issue that we have. As you'll recall, we are on a year-to-year contract with the department as opposed to, I'm sorry, a month-to-month contract, as opposed to a yearly contract. Again, we're trying to get off that, you know, trying to work with them to figure out what we need to do to get the contract back in place for a year. And they're going back and forth about what they need from us in order to do that. They're asking for quite a bit more reporting and information above and beyond what other regions have to do. They will not include in their settlement anything that has to do with past liabilities. If you'll recall, over the last couple of years, many CMHs spent millions of their own dollars trying to pay for all the services that were required. We had asked them if we could use some of our savings to address that past liability, and they're not willing to talk about it right now. However, they're not willing to put it in the written agreement, but at this point, the LRE has an appointment with the judge, and they're going to ask for written justification as to why they won't let us use those dollars to settle. So I'll keep you up to date on that. It's sort of a slow, torturous negotiation between the two, the LRE and the assistant AG. Like Matt said, we are talking about some changes with the operating agreement. One of those things will be, we have representation from each CMH based on size. We have 3 representatives from Ottawa. We actually have a vacancy. Network 180 has 5. I think Allegan has 2. And Mary Dumas, the new CEO at the LRE, is proposing to have everyone have 3. Each CMH will have 3 representatives. She feels strongly that everybody should have equal votes. And historically, the reason we went to that, based on the size of your CMH representation, I think was one of the iterations of the department getting involved with when we were having financial difficulties. One of the things they thought we weren't doing right was governance. So I think they kind of dictated that whole change. The other thing that's going to come out of that change in operating agreements, which is going to the LRE board in January, is a change in the funding formula. For those of you who have been around since the inception of the Lakeshore Regional Entity, we're currently on a 50% historical spending and 50% per member per month formula. Every other PIHP CMH in the state is purely per member per month. But if you recall, when we were looking at going towards that arrangement 6 or 7 years ago, Ottawa was going to lose $7 million. So of course we said, there's no way we can do that. So the reason we went to half historic spending, half per member per month, was to try to soften the blow. What's happened in the last 5 or 6 years with the department is they've changed the funding formula to really take into account the individuals we're serving. So if you look at what a projection for 100% per member per month is right now, Ottawa would still lose a little bit of funding, but it would be more around the $400,000, $500,000 range than millions of dollars. And given that, even though our budget today didn't look that good because we don't have our revenue yet, we're still projected to have additional funding that is unbudgeted. So I'm not opposed to going to that per member per month formula, because it's really not going to be a huge impact to us. Network 180 would have the biggest impact. They will actually see a difference of, I think, somewhere around $4 or $5 million. And it really is going to impact autism the most, the funding that is directed to autism. And then Muskegon Health West would get the most amount of money. So I'll talk more about that when we actually have to vote on it. And when it comes to the Lakeshore Regional Entity, there'll be more discussion about that.
What is the timeline for going to 100%? No, the PA2.
Well, that proposal, I think, is gonna come in January to Lakeshore Regional Entity.
Okay.
So
So then
we
it
would be
would
looking
be-
at it if it passes in February or March.
Okay.
One of the biggest reasons they're pushing that right now at the Lakeshore Regional Entity is because of CCBHC. And not to really confuse people, but 2 of our sites are demonstration sites and the rest of us are expansion sites. The expansion sites are grants through SAMHSA. So you get a certain amount of money and you can spend it doing these things for CCBHC. The other 2 sites, West Michigan and Muskegon, are in the federal site, that part of the grant. And that part of the grant actually they will pay per person who's enrolled in CCBHC. So the funding is going to come through the state, the federal government to the state, to those CMHs enrolled in those programs. And they need a way, they're basing it on per member per month, that formulary. So they really need us to move in that direction. Excuse me. I'm sure I've confused everyone completely and I apologize. I'll keep talking about that. The last couple of things. So we have had an increase in staff with COVID.
Because you cough.
Actually, this is 4 weeks better.
Oh, my goodness.
I tested negative for COVID, but I might have had the flu. Who knows? 4 weeks ago. So I'm not contagious, but I still have a cough. But anyway, we canceled our Christmas get together last week because we just had more and more people who were getting sick or in quarantine. We're still wearing masks. We are super busy rolling out CCBHC. It's all good stuff, but it's keeping Anna and her staff very busy. The last thing I'll leave you with, we've been going to the Board of Commissioners and Finance and Human Resources with requests for new staff. We probably will continue to do that in bits and pieces, and I apologize to the commissioners who we don't come with one big pile of ask, but we often, as you heard today, we don't know what our funding is until 3 months after we were supposed to get it. And there are new grant opportunities that come up all the time. Some of them are block grants through the department. We're getting a lot of SUD money through COVID. So I don't know that I'm going to not be coming to the Board of Commissioners and HR again with a few new requests in the next couple of weeks, but I'll tell you more about that before we do that. So the last thing we're going to do is watch 2 videos. One of them is the video that Matt referenced that West Michigan CMH put together to talk about the Shirky bills. And the other one, once we get up and running, is a really nice video that Holland Police put together that talks about our new crisis intervention team.
Patricia?
Yes.
Popcorn?
Yeah.
Oh, yeah, there's some in the cupboard over there.
From last year's.
They're short, 3 minutes. One's 3 minutes, one's less. And while she's doing that, I will also say happy holidays to everyone.
Yeah.
And hopefully you'll stay healthy.
In the same year, 42 million people in the US suffered from a substance use disorder. We've all been touched in some way by mental illness or addiction. Please take just 3 minutes of your day to watch this video. It contains crucial information that may affect you or someone you love. Recent legislation sponsored by Senate Majority Leader Mike Shirkey is an attempt to reboot the failed Section 298 from 2019.
That's not
That
good.
was off to a good start.
I wish it.
Houston, we have a problem.
By the purposefully misleading title.
There we go.
These bills do not increase access to care, increase providers, or address workforce shortages. They don't address the lack of inpatient care or guarantee better outcomes. Let's look at how these bills would really impact any of the 325,000 plus people who rely on our current public mental health care system, and also how it would impact the pockets of big for-profit health plans. Care. Senate Bills 597 and 598 are focused on contracts and money, not people. True healthcare integration takes place where people receive their services. These bills only change who is paying the bills. Cost. These bills will dramatically increase costs without guaranteeing better outcomes for the people served. Do we really want these health plans, who pocketed a record $550 million in profits last year, to have full financial control of our mental health services? Let's look at it this way. The current public health system carries an average of 6% overhead costs. Health plans have at least double the overhead, ranging anywhere from 12 to 15%. Because we have a set amount of dollars to provide care, the increased overhead costs will result in fewer dollars to provide the actual services to the public. Governance. Senate Bills 597 and 598 will totally eliminate control or decision-making at the local level and shift our money and mental health care decisions to out-of-state insurance companies. These care decisions that may affect you, someone you know, or someone you love will then be made in corporate boardrooms hundreds or thousands of miles away, maybe even not in Michigan. Performance. Historical evidence proves that healthcare plans do not have a good track record when it comes to behavioral health. The National Committee for Quality Assurance, the NCQA, annual report card rating for Michigan's 10 private Medicaid health plans shows an average of less than 2.4 out of 5 stars. This is a failing grade across 8 key areas for mental health treatment. What makes us think giving the power to these health plans will result in better care? We desperately need your help to stop Senate Bills 597 and 598. They are dangerous, costly, and bad for Michigan. Please like and share this video. And if you would like to take action, click on the link to sign our petition opposing Bills 597 and 598 and learn how you can get more involved.
Right.
Great if you
Yeah.
get TV stations that put that on as a public service kind of announcement.
It would.
So to speak.
I agree with you. Well, they have to do some. All right, go ahead. This is our collaboration with Holland Police Department and the Sheriff's Office.
The crisis intervention team is made up of myself, as well as an Ottawa County Sheriff's Deputy and 2 community mental health workers with Ottawa County Community Mental Health.
We're there to assist in connecting to resources, to offering mental health assessment and evaluation on site if possible, with the goal of not having to take a person to jail or even to the hospital if it's not necessary.
Our department has noticed that we've responded to a large number of calls for people in some kind of mental health crisis. So by having this team, we can better treat those people.
The crisis intervention team works collaboratively.
The 2 clinicians split our kind of location. So one of us is typically at Holland Public Safety, and the other one is with the Ottawa County Sheriff's Deputy.
We respond to suicidal calls, someone having mental issues, overdoses, check well-beings, sometimes we are the first responding officers to calls.
You know, if we're on a call and an individual is having a mental health crisis, or they have homelessness or food insecurity, there's things that we can do right then and there.
So how can we divert from jails when appropriate? How can we divert from hospitals when appropriate to even lessen the load at the other end?
We do that by talking to them. And we open up that conversation about what are the needs and what the issue is at hand. So the crisis intervention part kind of means temporary or trying to give some stability until we can put someone up with more long-term resources. It is a unique program to Ottawa County. We're the first of this kind in Ottawa County. We've actually been doing full response since mid-September.
As I've gone through CIT training, I think it's really helped me develop some of my communication skills as well as my empathy.
We went to Detroit. Wayne County hosted us. It was a 40-hour long CIT training. So we were there for a week and we were able to participate in various scenarios, scenario training and just topic training, and kind of focusing on de-escalation and community resources.
The human connection and empathy are important as far as that connection. And when we go out as a team, it's helpful because we have a very limited time to build that trust and rapport, but part of that is just having the time to listen.
The biggest difference has been noticed in people's reactions to when we may show up on scene versus just when a normal officer does, that we're able to not have any time constraints and sit with them for an hour, sometimes two, when our law enforcement agencies are better trained and when we have the ability to respond as clinicians. It tries to put everybody in a better place moving forward.
Yeah, so good stuff.
Yeah, very good.
Yeah, but that was pretty much me after our last board meeting. Lynn, I know you probably talked about this, I'm sure you have, but how do they get the phone calls? That comes from 988 or 911 or from whichever source, or?
Their calls are mainly coming through 911.
Okay. And so our dispatch is making that decision to send.
Well, no, so it's going to Holland PD or it's going to the sheriff, and then they can call directly to the CIT program.
Who's they? Sorry.
The dispatch can make the calls directly. They can also, a lot of what they're doing isn't necessarily going out on crisis calls. I mean, they are doing that, but they're following up on reports from other officers. So someone might have gone out on a call yesterday and said, hey, this family's really struggling, or this person's really having a problem. Can you go back out?
They had just said that sometimes they're the first folks to show up. Maybe that doesn't happen all the time. Is what you're saying.
Not all the time, but that's available as well. That so we can go on crisis calls.
Will reach out to CIT, or they'll reach out to sheriff, and sheriff may also make that determination as well.
Yep.
Oh.
So we're gathering statistics, but one of the things that Matt Messer has already said, who's the Holland police chief, is that they've noticed, and our sheriff said the same thing. They have people who are calling multiple times a day or multiple times a week. And since we've been able to have that team go out and do some problem solving and get them connected to resources, sometimes the calls are just dropping right off. So, and that's something that a lot of CIT programs will tell you, that their call volume goes way down because they're not going out repeatedly to the same homes in the same situations. So we are collecting data. We're involved in a pilot project through Wayne State University that's going to help us track data and come up with some reports on what we're doing and statistically how things are changing with call volume and that type of thing. And we're really just getting started with CIT. You know, there's lots of places we could become more involved. Central Dispatch is one of them. Either some places actually put a mental health worker right in Central Dispatch. A lot of places patch a worker in to a call. So yeah, it's really good stuff.
How do we give that out to more people? Both of the videos.
Well, we are posting the video on our webpage and we put it out on our Facebook page. And the CIT stuff is available right now on Holland PD. And I don't know if the sheriff's got it up on their website, but we can do that as well. Yeah, I mean, I think when we do get, you know, the news TV usually likes to hear about stuff like this, so we could reach out to them as well. Yeah, it's all good stuff. All right, that's all I have.
Okay. General information, comments, meetings attended. Second opportunity for public comment. You see anybody?
No public online.
Any public online?
Unless Jim wants to make it.
Okay, well, entertain a motion for adjournment.
So
All those in favor of adjourning indicate by saying aye. Aye. We're adjourned.
Yeah, you too.
the